Something we do quite a bit of is LDN, which is low dose naltrexone. We see it used in a lot of autoimmune problems, such as lupus or fibromyalgia, rheumatoid arthritis. We're seeing it more for Hashimoto's. We're using it for psoriasis. I'm seeing it for pain patients. We're seeing it even in cancer patients. We used quite a bit of low dose naltrexone with long COVID, and we're actually still seeing it used with long COVID. All the inflammation that occurs through the lungs, through the whole body. I mean, it occurs in the brain, it occurs everywhere. The fatigue that's associated with it, the feeling like you just can't function. Low dose naltrexone has really helped calm that inflammation, calm those areas where you can feel like you can function, you can feel like you have more energy. And we've had quite a few patients that have experienced that. We're just seeing it very used widely across the board. Typically, you're going to start at a low dose. It is low dose naltrexone, but we started a low dose and we titrate to our dose to reduce any side effects. There's a very, very, very low side effect profile. There's a very, very low drug interaction profile. It's a wonderful immunomodulator, and it works on all the inflammatory cytokines to kind of calm all that down so that we don't see as many flare-ups. We don't see as severe flare-ups when they do occur. LDN works so well because it calms inflammation. So when we talk about inflammatory cytokines, or we hear about cytokine storm, we heard this a lot with long COVID and how there was so much inflammation associated with the effects of COVID. So when we use something like low dose naltrexone, it really helps to calm those inflammatory cytokines. It's a fancy way of just saying it's a fantastic, probably the best anti-inflammatory there is to calm that down. It calms the triggers, it calms the extent of the triggers, the severity of those triggers, to really keep inflammation at bay and really calm it down. And that's why LDN works so well for so many types of diagnosis, because most all diagnoses stem from inflammation, or there's some sort of inflammatory factor within them. So LDN works so good across so many disease states because it can really calm that inflammation. So it's very important with LDN that you work with your practitioner and the pharmacist. We call this a triad between the patient, the pharmacist, and the practitioner. So we can all work together to find what dose is appropriate for you. It definitely is something that we titrate up to. We titrate to find your specific dose. Sometimes most people can go into a typical 4.5 milligram dose, but not everyone fits there. So it's very important to, talk about anything that you may be experiencing, good and bad, so that we can help find that correct dose. And really feel free to talk to your pharmacist and or your practitioner so we can all work together to find the right dose for you.